Thank you for that generous introduction, Assistant Professor Tejano, and good morning to all. NSF Asia Pacific is honored to participate in UPV CFOS Institute of Fish Processing Technologies Taking You Forward talk series. Thank you for this opportunity for our organization to share information on food and worker safety in this unprecedented and challenging time of a COVID-19 pandemic. I hope to share a few of the control, prevention, and best practices for seafood processors this morning. The first COVID-19 outbreak was linked to a seafood market. That marketplace was not exclusively selling seafood. It was known to be a place where wildlife trading also happens, and the sale of wild animals may have been the source of infection. With this, there was an initial concern on the food safety of seafood and questions such as, can I get COVID-19 virus from eating seafood? And should seafood be tested to ensure it doesn't contain coronavirus, have affected the demand and consumption of fresh seafood globally. However, there is currently no evidence of human or animal food or food packaging being associated with the coronavirus transmission that causes COVID-19. Unlike foodborne gastrointestinal viruses such as norovirus and hepatitis A that often make people ill through contaminated food, this particular coronavirus causes respiratory illness and spreads from person to person. According to World Health Organization, as food has not been implicated in the transmission of COVID-19, testing of food or food surfaces for this virus is not recommended. While for the U.S. Centers for Disease and Control and Prevention, the risk of infection by the virus from food products, packaging, or bags is thought to be very low. Currently, there are no cases of COVID-19 identified where the infection was supposed to have occurred by touching food, food packaging, or shopping bags. Let me quickly share with you some characteristics of the coronavirus. The coronavirus needs a living cell to reproduce and can survive in the environment for a limited period. It can stay for a limited period on a variety of contact surfaces. It is transmittable from people that might or might not exhibit symptoms of being infected and can also be transmitted through the air. And as I have mentioned earlier, there is no evidence of foodborne transmission through the digestive tract today. It is important to remember that a significant form of virus transmission between people is airborne or through droplets generated by breathing, sneezing, or coughing. Understanding this route of transmission is essential for COVID-19 infection prevention. This image describes a danger zone where infection risk is greatest to understand the importance of airborne transmission further. Outside this zone, the risk of infection is minimized. I hope this is something that all of us here know by heart, that social distancing is a key preventive measure and a distance of 6 feet or 2 meters is a safe distance to maintain between individuals. I have discussed airborne transmission, but there is another route where COVID-19 virus is transmitted, and that is through surface transmission. The environmental stability of the virus on the contaminated object we call fomites requires additional precautions to control the spread of COVID-19. COVID-19 can be transmitted by fomites. The contaminated objects are clothes, cardboard, or plastic. And because viruses have been shown to persist on contaminated surfaces, transmission through contact with an unclean object or contaminated surface is possible, especially when a person touches an unclean surface, then touches their mouth, nose, or eyes. Several studies demonstrate the survival of the coronavirus on surfaces of different types of materials. So, I want to ask our audience to guess at how many hours the viable presence of the COVID-19 virus remains on each of the surface by typing in their answers in the chat box. So, can you type in your guesses? This will be a number of hours po ha. On first, plastic. Second, stainless steel. Third, cardboard. And lastly, copper. Okay. I'm sorry. I hope our participants are starting to type in their answers. Apologies, I can't see the chat box, but I hope you're all participating in our mini quiz. So I hope you guys have already typed in your answers. So let's see if your guesses are correct. So according to this study published on March 17 last year on aerosol and surface stability of SARS-CoV-2 compared to SARS-CoV-1, this is the number of hours the viable presence of SARS-CoV-2 virus remains on each surface. So for plastic, it is up to 72 hours. Stainless steel is 48, while cardboard is 24. Copper surfaces have the shortest number at up to 4 hours. But let's focus on these first three, as these are the most common surfaces we encounter at the processing plant. In coming up or revising the cleaning and sanitation schedule, the COVID-19 safety and cleaning and sanitation teams must consider this data and make sure the proper cleaning frequency is applied. Considering the characteristics of the coronavirus, its various forms of transmission, and ability to survive in the environment, there are 4 pillars to COVID-19 prevention. That is social distancing, regular hand washing, the use of proper personal protective equipment, and routine cleaning and disinfection. The risk of transmission of any infectious disease depends on the distance between employees, the duration of exposure, and the effectiveness of employee hygiene and sanitation practices. Later, I will share a few of the actions that will help practice this in the seafood processing area. We should always emphasize the importance of effective and proper hand washing to all. There is a significant difference between a quick hand wash and a COVID-19 hand wash. This figure shows you the proper hand washing technique. By the way, just a quick reminder, hand sanitizers and alcohol gels do not replace hand washing. Pandemic response of any organization should include policies on mask use and ensure that suitable supplies are available and accessible. Furthermore, the disposal procedure should not be overlooked. It is necessary to identify the personnel responsible for disposal must be instructed to take precautions such as wearing gloves when handling used PPE. In developing a good cleaning and sanitizing routine, it is necessary to identify all the points of frequent contact and establish a system to ensure consistency in the cleaning and disinfection program. I just want to differentiate quickly cleaning versus disinfection. So cleaning is the act of removing food, soil, and other debris from an unclean surface, while disinfection is the act of reducing the germ level, bioburden, or in the case of COVID-19, the viral load from an unclean surface. Understanding the difference between these two is important, and knowing what agents are effective against coronaviruses. So if your current program is designed to eliminate mold and bacteria, ensure it will also be effective in removing virus particles. The procedures used to prepare sanitation agents must also be accurate, easy to follow, understandable, and accessible. Also, the cleaning personnel must have suitable and sufficient cleaning materials available for use. And lastly, and of equal importance, is proper monitoring of procedures to confirm the effectiveness and safety of the cleaning and sanitation program. When the organizers asked us to present the implications of COVID-19 on the certification for seafood HACCP compliance and prerequisite program, one significant development we have identified is the introduction of technology to conduct third-party certification audits. As a response to last year's country lockdowns and limited air travel options, The remote audit has allowed companies to acquire or renew their third-party certification. Though the Global Food Safety Initiative only recognizes blended audits or an audit that involves virtual and on-site checks, some certification program owners such as the BRCGS, the FSSC 22000, started to offer fully remote food safety audits. As to the HACCP standards and implementation, and as I pointed out earlier, no studies prove that the virus is transmittable through food and the digestive tract. Thus, this is not considered a food hazard. The seafood processing plants and the entire manufacturing sector have long been practicing the sanitation procedures and personal management that they didn't have any problems adjusting to what we have considered the new normal. In some plants that we work with, they have long been practicing temperature checks before entry. The staff is monitored and not allowed if they're not feeling well. There's also a regular hand washing schedule where the time interval and an alarm to notify the processors in the line to take hand washing break are in place. The use of PPE such as mask, mouth shield, and protective uniforms were already practiced. The only difference now is that these practices are intensified and vigorously implemented. So for routine cleaning and disinfection practices, so now the cleaning and disinfection schedule is more frequent. The focus is on the major touch points and areas with most human traffic, and the cleaning materials used are effective to disinfect the target virus. While to support proper social distancing, the movement of people within the processing area is further limited. There are installation of physical barriers. Also, the ventilation is enhanced, increasing insisting ventilation, the outdoor and indoor change rate, air filtration through HEPA air purifiers, and increasing the exchange of fresh outdoor air into the facility is critical. Increasing circulation may be helpful as long as the facility is bringing in new outdoor air. Use of UV lamps when increased ventilation is not possible. So to assure the safety of workers from damaging UV rays, only professional engineered UV systems should be installed. There are also fewer workers but more shifts to maintain the same productivity. Most of our seafood plants, they follow the IATF and the local government guidelines on the maximum number of employees allowed to report depending on the community quarantine classification. The health monitoring is intensified. So there's mandatory vaccine for all employees. Some do regular antigen testing. Some do it every 7 days. Some do it every 14 days. They also arrange accommodation and transportation for employees. Workers should not report to work nor be encouraged to report to work if they appear sick or are they experiencing symptoms. They also provide workers information on the facility's return to work policies and procedures, and there's screening of visitors. So some of our clients, they require us of negative RT-PCR swab test, and a health declaration is required for extremely essential visitors. The COVID-19 safety officer. So this is a regulatory requirement of our IATF. So this is required for all business sectors to be allowed operation during the pandemic. And this COVID-19 safety officer must be properly trained and regularly updated on COVID-19 safety guidelines and changes in the regulatory health requirements. And speaking of training, I'd like to share with you some sites where you can access reliable COVID-19 safety guidelines to conclude this talk. You can check out the U.S. Centers for Disease Prevention website, wherein you will find this comprehensive checklist they have developed specifically for seafood processing work sites. The Sustainable Fisheries Partnership has also compiled a good number of online international resources on its website, covering from vessels, fisher's crew, to seafood safety. And the Global Aquaculture Alliance also developed a COVID-19 guidance document for seafood supply chain. You can find this all at their website. And lastly, NSF International offers this free COVID-19 online training series to help organizations with COVID-19 response planning. The online course was developed in collaboration with NSF's Check by NSF program, an independent verification of COVID-19 risk mitigation efforts. So this training will help drive culture change, habit formation, and good communication practices in any industry or sector. This online training is a 4-part module. You can get a certificate of completion after you pass the assessment. You can visit our website at www.nsf.org, where you will find the link to our e-learning site. So there's so much to share, but hope despite this limited time and short presentation, the online audience learned and pick up critical points that will help develop a robust COVID-19 response program and ensure the safety of our seafood and processors as well. Our country director, Ms. Suzette Arlico, will join me later in the open forum to help answer questions from the online audience. Again, thank you to the Institute of Fish Processing Technology and UPV College of Fisheries and Ocean Sciences. We are honored to be part of this talk series and looking forward to more collaborations such as this in the future. So everyone, please remain healthy and safe. Maayong aga sa tanan.